Hello, everybody. It is my pleasure to present our data on HIV trace versus the phylogenetic analysis that we have conducted to unravel transmission clusters in Spain. So, as you all may know, evaluating transmission chains helps to establish epidemiological measures in order to limit HIV spread. And tools that allow real-time evaluation of transmission chains in a simple way and that are accessible to non-highly specialized molecular epidemiologists will certainly help. HIV-1 TRACE is a new computational tool to identify molecular transmission clusters in large databases. And it is based on viral genetic relatedness to a reference sequence in order to construct and visualize the connections among clusters. So in this paper, we aim to identify transmission clusters in CORIS, which is the Spanish cohort of antiretroviral naive adults, by using the HIV-1 TRACE computational tool. And of course, we wanted to compare those results with other phylogenetical approaches to really see if this HIV-1 TRACE tool is really working well or not. So for this, we used the RD available regions from newly HIV diagnosis in 2018 in CORIS. TRACE was used to estimate the transmission clusters in 484 subtype B antiretroviral naive patients. In parallel, we conducted Phi analysis by using maximum likelihood method with a bootstrap evaluation using the GTR plus G as nucleotide substitution model. Sequences were phylogenetically analyzed along with all the most similar sequences as identified by a blast search, and local transmission networks were defined as phylogenetic clusters receiving a bootstrap support value above 70%. So this is what we found in 484 patients, subtype B patients, using the HIV-1 TRACE tool. 130 patients clustered together. We found 54 clusters with a mean cluster size of 2.4, a median cluster size of 2 individuals, and the range was from 2 to 6 individuals with an interquartile range of 2 to 3. This is the spatial representation by the HIV-1 TRACE data monkey web server, and here you can see the nodes, and the node size represents the number of patients included, that, as we have seen before, ranged from 2 to 6 patients. Here you can see the biggest nodes, which were formed by 6 patients, and here you can see the representation of smaller nodes, which are composed or formed by just 2 patients. We wanted to know how the trace network characteristics were, and here we found that most of the patients that clustered together were men, and were men that had sex with men. Here you can see the numbers. The patients were not, there were no differences in when we looked at the geographical origin. Here you can see Spanish patients that were from Spain, the number of clusters, and here you can see the patients that were from Spain and that were coming from abroad, and both were higher than those patients that were just coming from abroad. Most of the patients that were clustering lived in the same city or were very, very close with a geographical relationship. And interestingly, when we looked at the patients that were not related by the geographical proximity, we found again that the most of these patients were patients that were men that had sex with men, and most of these patients, the majority, were living in three big cities in Spain, which are Barcelona, Madrid, and Sevilla. And here you can see the interchange between these cities and the relatedness between the patients. And of course, we did not only found that these patients were coming from these three big cities, but a small number of patients were coming from other cities and came into these big cities and got infected there. As we said before, we wanted to know how TRACE performed versus phylogenetic analysis, and here you can see what we found. So using phylogenetic analysis, we found more patients that were associated in clusters. 154 patients were clustering together using Phi analysis, and as you remember, 130 were clustering when we used the TRACE tool. We also looked at the proportion of patients that were clustering using TRACE and phylogenetic analysis. And here you can see that for those patients, those clusters that were formed by just 2 patients, we found more clusters using phylogenetic analysis. And here you can see the results that we found using Phi analysis and TRACE when we compared just the patients that were included in 3 patients per cluster, 4 patients, or 5 patients. So with this, we would like to conclude that the implementation of HIV-1 TRACE as a new computational tool is feasible and allows to identify transmission clusters. HIV-1 TRACE is an easy-to-use tool allowing the identification of transmission clusters in real time. We believe that this is really important because it allows the use of cluster analysis for labs that are not really skilled in a proper phylogenetic analysis, and this of course will help to do more and more studies of clustering and transmission, and of course to limit HIV spread. Our data revealed that HIV-1 TRACE identified fewer clusters among the B subtype Spanish patients from 2018 than traditional phylogenetical approaches. Differences were mainly driven by the non-use of a threshold in the patristic distances when we used phylogenetic analysis. And of course, we feel that more phylogenetic studies are necessary to assess the steadiness of the new HIV-1 TRACE tool. So with this, I would like to stop, but before I'd like to acknowledge the Italian team that helped us in this study, led by Mariela Santoro and Luca Cariotti, and of course the Greek team that also helped us and was led by Dimitris Paraskevas and Evangelia Kostakis. So thank you very much, and I will be happy to take any questions. Thank you.